Hello, my name is Charisma Lee. I'm a registered nurse and a student at Wilkes University Master of Science in Nursing program, and I'm here to conduct a physical assessment based on the following case study. Mrs. J is a 39-year-old woman who presents to a primary care center for evaluation of headaches. The headache is a pressure across her forehead and is 45-10 on the pain scale, usually lasts an hour or so, and occurs 2 to 3 days per week for the past 2 to 3 weeks. This headache became more severely yesterday, lasting for several hours, and it was a 7 out of 10 on the pain scale. She reports fatigue, nausea, feeling hot, and slight muscle weakness in her right hand, but denies vomiting, floaters, polyuria, polydipsia. She also reports very heavy periods for the past 6 months. She isn't sure if she's catching a cold. Several coworkers have been sick, and she feels like she is getting stuffy nose and her neck is sore. Hello, my name is Charisma. I will be conducting your physical assessment today. May I know your name, please?
You could call me Mrs. J.
Mrs. J, nice to meet you. I'm Charisma. What basically brought you to the clinic today?
I've been having a headache.
Oh, I'm sorry to hear that. From a scale of 1 to 10, how do you rate your pain scale?
Right now, I would say it's a 4 to 5, but last night it was definitely a 7.
Okay. Can you describe me the duration of your headache?
The duration of the pain has been lasting maybe about 2 to 3 days.
And where is the headache located at?
Oh, it's my forehead.
It's in your forehead? And like the frequency, how do you get it often, like your headaches?
It's been on and off for the past 2 to 3 weeks.
Okay. Are there any precipitating factors on your headache?
Yes, I've been having heavy periods. Also, I've been having stuffy nose, nausea. I've been having some fatigue and right-sided hand weakness.
And how long you've been experiencing heavy periods?
For the past 6 months.
Okay. Have you been experiencing any increased thirst?
No.
Are you experiencing any increased urination?
No.
Okay. So what I'm going to do right now, I'm going to take your vital signs. I'm going to take your temperature, your blood pressure, your pulse, your respirations. Okay, blood pressure is 112/65. I am going to check your pulse. Okay, your pulse is 72 and respiration rate is 18. And I'm going to take your temperature. It's going to be in axillary. Okay, temperature is 36.8. Okay, what I'm going to do right now, I am going to listen to your breath sounds and as well as your heart. Okay, Mrs. Jones, I want you to take a nice deep breath for me. Okay, I'm going to check the breath sounds on your back. I want you to take a nice deep breath. Okay, no adventitious breath sounds noted. Okay, Mrs. Jones, I'm going to assess your head. I'm going to inspect and palpate your head. Okay, there are no mass and there's no lesions noted on the head. Okay, Mrs. Jones, I'm going to inspect and palpate your neck. There's no enlargement of the neck. I'm going to palpate your neck. Okay, there's no enlargement of the lymph nodes. Okay, Mrs. Jones, I'm going to inspect your eye. I'm going to shine a light on your eye using a pen light. Okay, the pupils are round, equal, reactive to light and accommodation. I'm also gonna examine your internal eye using an ophthalmoscope. Can you look at me, please? The red reflex is present, the optic disc is well defined and sharp, and the fundus is yellowish reddish in color. Okay, Mrs. Jones, I am going to inspect your inner ear using an otoscope. I'm going to pull back your left ear. Okay, your tympanic membrane is pearly gray in color. There is no bulging and there's no perforation. I'm going to inspect your right ear. I'm going to pull back your outer ear. Your tympanic membrane is in pearly gray color. There's no bulging and there's no perforation. However, there's like a few cerumen noted, but there's no discharge. Okay, Mrs. Jones, I am going to inspect your nose. Your nose is in the midline and it's symmetrical. I'm going to inspect your nasal cavity using an otoscope. Can you please tilt your head back? I can visibly the inner and middle turbinates. I can see a clear film of discharge. The color of the nasal mucosa is deep pink. There is no perforation on the nasal septum. I'm going to test your cranial nerve 1, which is the olfactory nerve. Can you please occlude one of your nares and can you tell me, and close your eyes and tell me what you're smelling? Okay.
Lemon.
Okay. Can you please occlude the other nares and tell me what scent is this?
Perfume.
Very good. There is no obstruction, nasal obstruction, and her sense of smell is intact. Okay, Mrs. Jones, I'm going to inspect your mouth and your throat. Can you please say ah? Okay, I'm going to test your gap reflex. Can you stick out your tongue from me? Can you move it to the side and to the other side? The oral mucosa is moist, pink, and intact. The uvula is in the midline and it's not touching. This tests the cranial nerve number 12, hypoglossal. Okay, Mrs. Jones, I'm going to test your fine motor function using a rapid rhythmic alternating movement test. Since you're complaining of a right hand weakness, can you please place your palms over your lap? Can you turn them upside down? Faster, faster. Okay. And I want you to test your fingers to touch your thumb to each of your fingers on each hand. All right, very good. Okay, that tests your fine motor function. Okay, Mrs. Jones, I'm going to ask you information about your reproductive health history since you're complaining of heavy bleeding within the past 6 months. I wanted to ask you regarding in what age did you started having your menstrual period?
I started having my period when I was 12.
Okay. And when you get your monthly period, what is normally like the duration of your menstrual cycle?
It's about 5 to 7 days.
5 to 7 days. Do you experience any pain during menstruation?
Yes, a lot of pain.
A lot of pain. And also, like in terms of the consistency, do you notice any clots during your menstruation?
Yes, so lots of clots.
And lots of clots. Okay then. And on a daily basis, how many pads do you saturate?
About 5.
About 5. Okay. Based on the findings that I conducted from my physical assessment, including Mrs. Jones' symptoms, I came up with a differential diagnosis of migraine and menorrhagia. Mrs. Jones, I recommend you to obtain a CAT scan of the head and MRI of the head to rule any tumor, lesion, mass, or malignancy in order to have a baseline. I also want you to see a neurologist for further evaluation of your headaches and also for your right hand weakness. I also recommend you to obtain blood work such as CBC to monitor your hemoglobin and hematocrit levels due to heavy bleeding. I also want you to see an OBGYN for pap smear to rule any cancer. I also recommend you to continue taking analgesics such as Tylenol for pain as needed. And lastly, I also recommend you to make an appointment for follow-up in the next 2 weeks in the clinic. This concludes my video assignment for my advanced assessment health class.